Today, the CDC is pledging to do better, admitting it botched its response to the COVID pandemic, including confusing and shifting public health guidance and a slow release of critical data. That from CDC Director Dr. Rochelle Walensky after an internal review and amid concerns about the agency's ability to tackle monkeypox and the reemergence of polio.
Our public health infrastructure in the country was not up to the task of handling this pandemic. We made some pretty public mistakes, and we need to own them.
And joining me now is Dr. Anthony Fauci, Chief Medical Advisor to President Biden and Director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, thank you so much for being with us.
Good to be with you. Thank you for having me.
Well, I want to ask you first about a sister agency, the CDC. I know you're loath to criticize other agencies, but they have been so self-critical. Dr. Walensky, in an extraordinary statement, a scathing report that she herself commissioned, saying that from top to bottom there are really major changes. Is the agency up to those kinds of changes?
I believe so, and I think they should be commended in the fact, particularly Dr. Walensky, realizing and recognizing the shortcomings that have been there for quite a long time, long antedating Dr. Walensky's tenure. And I think it was the stress and the challenge of a historic pandemic that brought some of those deficiencies into sharp relief. So I believe we should commend them for realizing that, particularly Dr. Walensky. There are very, very good people at the CDC. There was an issue with the culture of how they approach their responsibility as a public health agency that I think has now been recognized. So I'm actually optimistic that given the fact that the problems have now been recognized, that there's a pathway to making a very good organization much better.
You know, and during the Trump years, to be perfectly honest, a lot of us saw the shortcomings in the CDC, but we thought it was because of political interference, and there was political interference certainly in the press operations. We saw that between the White House and the CDC. But that seems to have been a separate issue, that there really was an underlying cultural, bureaucratic problem, right? Correct?
That is absolutely correct, Andrea. It is a fact. It's a painful fact. The good news is that they recognize it, and you're not going to fix something unless you own it. And as Dr. Walensky clearly stated, they made some mistakes. They've got to own it, and the only way to correct it is to realize that you have an issue, somewhat of a deep-seated cultural issue that they recognize and they will correct. So I'm quite optimistic that my colleagues and friends down at the CDC are going to be able to regroup and handle this.
The CDC now is saying that it does not have the authority to shift its funding to tackle public threats. That seems to require legislative action. And if so,
right,
in this climate of a divided House and Senate, and who knows what's going to happen next after the election, how important is it for them to get that authority?
Well, they listed, Andrea, a number of authorities, transactional authorities that they would need to be able to respond in a more fluid, expeditious manner when they get challenged with an outbreak. So I do hope that the Congress is responsive to their needs. I would hope so, because it would be important for us, not only for a continuity of our response against the current challenges, but also the inevitability that we'll have future pandemics. So what they're asking for is quite reasonable, and I hope that they get it.
Dr. Fauci, let's talk about COVID, because we're expecting in a couple of weeks that this, this booster for the Omicron subvariant is going to be available. First of all, is it in time? Because this subvariant just went viral a couple of months ago. And by the time this booster is available, will there be another mutation that we have to worry about?
Well, we certainly still have a considerable problem, Andrew, with BA.5. So the idea of in the next few weeks, as we get into the early part and middle part of September, to have an updated BA.5 bivalent variant booster available for people, I think, is a very good thing. Even if there are some changes, I mean, unless we get a completely different variant, which would be very unfortunate and probably unlikely that that would happen, but nonetheless still possible. If we get a moderate variation of the BA5, getting a BA5 specific booster would likely cover it to a considerable degree. So I think it's a very positive step in the right direction to make an updated booster being as closely matched as we possibly can to what is circulating and what might be circulating in the fall.
Will there be enough of these boosters to go around? Will they be easily available at drugstores? Have we fixed the distribution problem?
Yeah, I mean, actually, from the beginning of the administration, we really didn't have much of a distribution problem. That was fixed pretty quickly. We have a problem of people wanting to get vaccinated, Andrea, much more so than people who want to get vaccinated who don't have access to it. So what we need to do is we need to get people to appreciate the importance of not only getting vaccinated, but by keeping their boosters up to date, because the data that show the difference in severity of disease between the unvaccinated and the unvaccinated and vaccinated with boost is dramatically different. So that's what we need to do. It's not a question of accessibility. It's a question of getting people to be vaccinated with vaccines that are available.
And that's the message that you have to get out, isn't it? That there is such a difference in the degree of illness, because so many people did get COVID because of this Omicron subvariant, this BA5. And so they said, well, I'm fully vaccinated, I'm double boosted, how could I get it? You know, and then some people take Paxlovid and then get a bounce back, as the president did. So people began to feel, well, maybe these vaccines are not that important. But what you're pointing out is so important that
absolutely.
They're not going to the hospital.
Well, I mean, if you look at the difference in hospitalization and death between unvaccinated and vaccinated, the curves, even for people, Andrea, who are not used to looking at these curves, are so obvious that the deaths and hospitalizations look like this for the unvaccinated and look like this for the vaccinated and boosted. So the data are overwhelmingly clear.
Dr. Fauci, let's talk about polio, because when I grew up and the Salk vaccine was first coming out, this was considered, you know, the absolute most important thing. As kids, we lined up to get it eagerly. My father had polio. You know, we lived with that all our lives. He certainly did. How could polio be reoccurring in our country in 2022? And how concerned?
Well, what we need to understand is that the polio that we saw in this individual in Rockland County who had paralytic polio is a vaccine-related polio. And let me explain what I mean is that the original Sabin vaccine, which is a live attenuated vaccine, has in it multiple different types of the polio. One is a type 2, which is a virus that when you vaccinate someone with a live attenuated vaccine, it can be excreted in the feces and get out into the environment, and it could revert to a more pathogenic form. So what happened with this individual is that they likely got infected from someone who had a vaccine-related polio. Now, the vaccines that we have been giving in this country over the last several years has been not the live attenuated, but the killed or Salk vaccine, which has no chance of getting transmitted as a vaccine-related polio. The solution to the problem, Andrea, is to get everyone who is not up to date on vaccinations, particularly children, to get them vaccinated, because the protection against polio of the Salk vaccine is about 99%. So you ask me if I'm worried about it. I'm only worried about it to the extent that people are not vaccinating their children. There are some areas, particularly in Rockland County, where only about 60% of the children have been vaccinated. And in some areas in that county, as low as 37% of the children have been vaccinated. So if you want to put a dead stop to polio in this country, then just get everybody vaccinated who needs to be vaccinated, and it would be the end of it.
And monkeypox. Now you've got the sole manufacturer throughout the world objecting to the way the U.S. stretched the vaccine by stretching the doses and injecting it in different ways subcutaneously. And there is not enough vaccine to go around. I mean, is this another example of a bungled CDC response?
Oh, it is not. It has nothing to do. Please don't blame the CDC for this. This is not a CDC bundled response. What it is that the demand, at least now, will catch up with that, but the demand for the vaccine is greater than the supply, even though we are now doing much better. We have over 600,000 doses that have been distributed, another 400,000 that likely will be greatly expanded because you now can get 5 times as many of the doses in a vial as you had before. I'm still not completely understanding why the company has concern over this, because if you look at a very good study that was done by grantees of the NIH in 2015 showed that if you give intradermally a dose of the vaccine at 1/5 the dose, it gives you an immune response totally equivalent to a full dose that's giving subcutaneously. So this is a positive thing. It should not be looked upon as something negative. It's a very effective way to expand the number of doses that we have.
Dr. Anthony Fauci, as always, our thanks to you on so many subjects. Thanks for being with us.
Good to be with you, Andrew. Thank you for having me.
You bet.